Okay, so we'll go ahead and start then. Okay, good afternoon, everyone. Thank you for joining. This is our first virtual COBRA meeting, so hopefully things will go well, but I always encounter interesting challenges when having virtual meetings, and so we shall see. This meeting will have simultaneous interpretation, English-Spanish. So I think we'll start by having the interpreter explain how this will work.
Good afternoon to everyone. This will be a brief explanation in both English and Spanish of how to use the interpreting function this afternoon. Durante esta reunión se ofrece el servicio de interpretación simultánea. Una vez habilitada la opción y el servicio de interpretación después de esta explicación, aparecerá en su pantalla este icono que se parece a un globo. Y al seleccionar este icono, usted podrá seleccionar su idioma, ya sea español o inglés, para poder escuchar la traducción simultánea. So once the interpreter function is set up, which will be just following these instructions, this icon will appear at the bottom of your screen that looks a little bit like a globe and says interpretation. You can click on that icon and select your language. There will be a presentation in Spanish, so for the English speakers, you will also want to click on English to use the interpreting services. Thank you.
Okay, thank you very much. I think that's great that we're having interpretation, and hopefully it will work well. Before we start, I just wanted to advise you that I'm in an area where I have very poor internet reception. So if I somehow get dropped, Hector will pick up, and then hopefully my co-chair, our Consul Carlos Gonzalez, will be able to carry on with the meeting. Anyway, today I have the honor of leading this meeting with my co-chair, the Honorable Consul General of Mexico, Carlos Gonzalez Gutierrez. Now, before I ask him to say a few words, let me just mention that we have a new member of Sandag's Borders team, and you'll be hearing a lot from him. His name is Carlo Felix. He's a binational person with experience in San Diego and Mexicali. He knows the border well. He had worked at the San Diego Regional Chamber of Commerce and attended SDSU. So welcome on board, Carlo. We look forward to working with you. Now let me ask the Consul General if he would like to say a few words. Carlos?
Thank you very much, Paul. It's truly a pleasure to be the co-chair with you of the Committee on Binational Regional Opportunities at SANDAG. I remember that this was one of my first activities when I arrived in San Diego about a year ago, and so it's always a pleasure to coincide with you and with all our friends at COBRO. If I may, and knowing that we have a full agenda, and I should take only just a couple of minutes, because I know that all of you are interested in the binational dialogue and collaboration that characterizes the relationship between Mexico and the US, and in particular San Diego and Baja California. I would like to take this opportunity to very briefly update you all on 3 issues that are of great interest to the region. First, health collaboration amid COVID-19. Secondly, the Tijuana River Valley. And thirdly, border infrastructure, because in these three areas, there has been news that I think are very positive, and I want to make sure that we are all on the same page. So issue number one, binational health cooperation amid COVID-19. As you know, the Consulate General of Mexico, like all the other 50 Mexican consulates in the US, we have remained very active in our efforts to ensure health access to the community during the progress of the pandemic, regardless of the migratory status of people who need our help or who need the help of local authorities. We work very closely with the County of San Diego, the Health and Human Services Agency, in part because they realize that being Latinos, 36% of the population in the county, the fact that they represent 62% of total positive cases and 48% of total deaths, that is a sign of alarm, and that we need to do we need to undertake together emergency measures in order to reduce the exposure of the community to the pandemic. I see my friend Justin Coso, part of this call. She no me dejará mentir, as we say in Spanish. Unfortunately, as of today, 60 persons born in Mexico have passed away because of COVID-19 in the Consulate General of Mexico in San Diego. For sure, this is an undercount because the county does not ask about nationality to the people who, or to the relatives of the people who unfortunately passed away. But I want to recognize the efforts and the willingness to help and to collaborate of the health authorities of the County of San Diego. Starting September 14, from 8 a.m. to 3:30 p.m., the consulate has been able every Monday to offer a safe testing site for the Mexican and Latino communities to come over with their families and get tested for free. Last Monday, just yesterday, we have approximately 203 people. We are every Monday breaking a record. And I want to invite you, your families, your friends, to take advantage of this service that is being sponsored by the County of San Diego, and come to the consulate and help us, more importantly, help us let the community know that we don't ask about migratory condition, that the tests are completely free, that you don't need a previous appointment, and that is completely confidential. Moving on quickly to my second issue that I'd like to share with you is the Tijuana River Valley. As you know, this is a problem that we Mexicans, that Mexico understand that it's incumbent upon us to contribute to its solution, because we know that the sewage and trash flows coming from Tijuana have contaminated San Diego beaches, and therefore have become one of the main issues of friction, of binational friction in the region. Because we understand that it's incumbent upon us, both at the federal and state level, to work together with San Diego in order to solve this. Baja California, the state of Baja California, with its own resources, have finished the installation of three new pumps at the PBCLA, and using federal resources at the same time. The Mexican section of the PBCLA is now the one responsible of administering the PBCLA pump station. And now the federal government, the Mexican federal government, is in charge of supervising the rehabilitation operation and maintenance of the plant through the Mexican section of the SILA. I think that these joint efforts have had very positive results that are obvious to whomever wants to see, to the extent that during September, transboundary flows of water into the US have diminished almost to zero. And that's, for the most part, also true for the month of August. So it's been 2 months that we have had very good results in terms of transboundary flows coming almost to zero. However, I know that you are, that you know the area, that you know the region, that you know the problem. And I don't want to mean that everything is solved. In my opinion, there is still a lot of work to do, mostly in 3 main areas. One, we need to rehabilitate the San Antonio de los Buenos water treatment plant, which is not close to the border, but it still affects our common ocean. Secondly, we need to keep up with the improvements in terms of infrastructure of the Tijuana collectors. And thirdly, we need to keep up, and Baja California, Tijuana needs to keep up removing the sediment and trash from the river. And finally, Paul, if I may, I'd like to briefly talk about the third issue, which is border infrastructure, which is a top priority for us at the Foreign Ministry, for the Mexican government. It's a top priority for anybody interested in the correct implementation of the USMCA and increasing integration of our economies. Secretary Marcelo Ebrard is leading an interagency group that has identified publicly what are our infrastructure priorities. And I am glad to share with you that just yesterday or the day before yesterday, the president himself, President López Obrador, announced that Otay 2 was at the top of the infrastructure priorities projects for Mexico. Otay 2 is part of the 32 infrastructure projects that will receive new investments to begin construction work on December 2021. Comunicaciones y Transportes, la Secretaría de Comunicaciones y Transportes, as you know, has been moving forward with public bids to begin the project. Transparencia Integral SC will be the company in charge of negotiating the right-of-way acquisition, and Cal y Mayor will be the project manager. I want to thank, before I finish, I want to thank Caltrans and Sandag for allowing me to join the Council President Georgette Gomez in a tour to the US construction site of Otay 2. I am impressed and I'm very excited that we are getting closer to have Otay 2 as the new port of entry here in San Diego, Tijuana. Muchas gracias.
Okay. Thank you very much, Carlos. It's good to hear of so much progress on 3 very difficult areas, and we'll follow those with great interest. Before we move on, let me just remind you what the rules of the game are for our virtual meetings for COBRA members and for members of the public who wish to speak under public comment periods. For COBRA members, please note that you're not automatically muted by the meeting organizer, so you will have to mute yourself. And in addition, when you would like to speak, please turn on your camera or raise your hand by opening your participants panel on the Zoom toolbar and click raise hand. Uh, Once I see you, I'll recognize you at that time. If you are a member of the public and would like to speak on an item, please use the raise hand icon in the Zoom toolbar. When you're called on by the chair, you will be unmuted by Sandag staff. If you're calling in by phone, you may need to enter a *6 to unmute yourself. After your comments, you will be muted by Sandag staff. If you are calling into the meeting, please press *9 on your phone if you would like to comment on an item. All comments, whether emailed or live, will be part of today's meeting record. I hope that's clear enough. We may have some glitches. I apologize in advance, but I think we'll be able to move through this all right. If you have any questions about the process, we could address those now.
Chair, I do see a hand raised for attendee Javier Fernandez.
Okay. Is she unmuted?
I'm sorry, I was by mistake. I apologize.
Oh, okay. Thank you. Okay, so we'll continue with the meeting now. Normally we have self-introductions, but we have quite a bit of excellent content into today's meeting, and I just don't think we're going to have time for the self-introduction. So we'll just skip that this time, and hopefully next time we'll be able to do that. The first item on your agenda is approval of the meeting minutes. Do we have a quorum yet, staff?
Yes, Chair, we do.
Okay, so we need to approve the meeting minutes of May 7th, 2019, July 2nd, 2019, September 3rd, 2019, and February 4th, 2020. We have 4 sets of minutes, so please let me know if anyone has a motion.
I'll make the motion to approve the minutes. This is Efrain, South County, DC.
Okay. We have seconds from Denise and Laura. So all in favor? How do we vote on this? Raise our hand or say aye?
I can do a roll call, Chair, if you'd like.
Yeah, why don't you do that quickly?
Okay. Chair, Institute for Regional Studies of the Californians, SDSU, Paul Gangster.
Approve.
Co-Chair, Consulate General de Mexico in San Diego, Consul General Carlos Gonzalez Gutierrez.
Approved.
Vice Chair, South County Economic Development Council, Efrain Ibarra.
Aye, approve.
Consulate General of the United States in Tijuana is absent.
No, she's there.
Yeah, I approve.
Who is this? I'm sorry.
This is Consul General Sue Sarnio, sorry.
Okay, thank you. U.S. Customs and Border Protection. Absent. U.S. EPA Border Liaison Office.
Lorena, approve. Thank you.
Lorena, thank you. Gobierno de Baja California, Vivian Salazar? No. Absent. Otay Mesa Chamber of Commerce, Viviana Ibanez.
Yeah, a message, yeah.
Okay. San Isidro Chamber of Commerce, Jennifer Godoy. Jennifer? Center for U.S.-Mexican Studies at UC San Diego, George Mallinger.
That's Greg. Approve.
El Colegio de la Frontera Norte. Absent. Caltrans, Jose Marquez.
Approve. This is Jose Marquez.
County of San Diego, Justine Cozo.
Approve.
City of San Diego, Denise Garcia.
Approve.
City of Imperial Beach. Absent. City of Chula Vista. Absent. City of Tijuana, Mónica Morales Juárez.
A favor.
Implan, Rodolfo Agote Gutierrez.
A favor.
San Diego Regional Chamber of Commerce, Kenya Zamaripia.
A favor.
San Diego Dialogue Global Connect, Nathan Owens.
I approve.
West Coast Coastal, Paloma Aguirre. Absent. San Diego Tijuana Smart Border Coalition, Gustavo de la Fuente.
I approve.
Tijuana Innovador, Laura Arajo.
I approve.
Fundación Internacional de la Comunidad. Absent. That motion passes with those members present.
Okay, thank you. Thank you very much. Approved, and I'm glad we finally were able to take care of that. Do we have any public comments at this point?
There's no raised.
Staff, do we have?
No, Chair, there are no public comments.
Okay, do we have any comments from Cobra members? Yeah, I believe Laura, you have a comment.
Hello, everybody. Very nice to see you. Just a short comment to remind everybody that Tijuana Innovadora 2020 is on its way. We opened the event today. It was fantastic. And we just invite everybody to connect and listen to all the keynote conferences or panels, many of which talk about issues in our binational region. So thank you, Paul.
Thank you. Other comments? Okay, we'll move on to the next item then. We're now in the part of the agenda where we listen to reports, and we have three very interesting topics today. First will be the results of the SANDAG cross-border travel behavior survey, and Grace Mino from SANDAG is going to be presenting that. Grace?
Hi, good afternoon, everyone. My name is Grace Mino. I'm a senior research analyst here at SANDAG. We had brought the study to you. We presented it to you back a year ago, actually, on October 22nd, 2019, prior to the study launching. We collaborated, we answered questions, you all provided feedback, and then we also collaborated with the Consulate General of Mexico early on the survey questionnaire. And so we just wanted to give you an update on the results of the study. These are preliminary results because the report hasn't been finalized yet, but it will be in the next week or two. So next slide. So what information is being presented to you all today? We just wanted to provide a quick overview, and first would be the reasons for why we conduct this study. Then we'll do a big broad overview of the methodology that was used to conduct this study. We'll go over key findings. We'll also discuss how COVID-19 had impacted the research, and then we'll also discuss next steps that will occur. So Reasons for the study. Obviously, San Diego's geographic location is unique since we share the largest international border crossing with Mexico. The data that we collect helps inform our modelers and our planners with how cross-border travel behavior impacts the region's transportation networks and helps evaluate the changing patterns or needs. The last cross-border travel behavior survey was conducted in 2011, and there was also a need to obtain preliminary information for respondents' willingness to pay a toll for the future State Route 11 Otay Mesa East point of entry from both US and Mexico residents. So a methodology overview, and this picture that's being shown right now, those are the staff in the yellow vests are actually the survey, the people who are conducting the intercept survey. So the survey was conducted at all 3 ports of entry, San Isidro, Otay Mesa, and Tecate. The consultant was True North Research, and the subconsultant was BTK Consultant. The BTK conducted the intercept survey on the Mexico side while people were waiting in the queues to pass over on before they got to the CBP in the lanes. And Flagship Research was on the US side, and they staffed the kiosks on the United States side. So there was an intercept survey that was conducted, and CBX wasn't included in this survey because there was a study that was already conducted with CBX last in 2016, and we needed more updated information for travelers crossing northbound via cars, bus, or pedestrians, or using alternate forms of transportation such as public transit or biking. The surveys were conducted in English and Spanish, and it was dependent upon the respondent's preference. And the interviewers had tablets, and that's what they used for the intercept survey. There was also a second portion of the survey, which was called the travel diary. It was a travel diary retrieval. And so once respondents crossed over and they agreed to participate in the travel diary, they were given a travel diary, and and it was to track what they did on the United States side of like where they went and how long they spent at places, or how they got to certain areas and what they were doing, like what was their primary reason for traveling. When they would finish their trip on the US side, they would submit their travel diaries either to the staffed kiosk by Flagship Research on the US side, or they were able to do a secure online survey. They could do it themselves online via travel diary, and they were given a PIN number, and the PIN ensured that we didn't get multiple travel diaries back. So this ensured that we didn't have duplicate respondents. And then there was also telephone interviews, so that if they weren't able to submit their survey via a staffed kiosk or able to do it online because they didn't have an internet connection, somebody would be able to call them on the phone and do the interview over the telephone. And then there was a smaller subset of the larger participants who said they would travel with the travel diary, that they agreed to use a GPS system, and it's a global positioning system tracker. And the tracker was just to help us verify that none of the trips were missing, and we just wanted to ensure that we were getting the most up-to-date and confirmed information as possible. And then those who did complete the travel diary, because it was the travel diary and the GPS tracker, because it was more of a intensive questionnaire, they received an incentive. So I know there's a lot of info on this page, and I'm not trying to give you that much level of detail, but I just wanted to show you all the different considerations that were being made when we were thinking about the study and while the study was going on. So again, as I mentioned, it was conducted at the 3 ports of entries, and every lane type was considered: general, ready, century, and pedestrian. Weekday peak and weekday off peak was also considered into when collecting the survey. And so the consultant ensured that we got a good number of respondents so that the survey would be representative of the people who were crossing over. So the goal for the intercept survey was to complete 7,500 intercept surveys, and our consultant actually got almost 7,900 intercept surveys. The raw data was weighted to a data set that was given to us by the United States Customs and Border Protection, and we just want to thank them for their cooperation. And one thing that was completely different from with this study from the 2011 Cross-Border Travel Behavior Survey was that this time we included US residents for the VOT, or the value of time portion of the survey. We weight the data to ensure that the sample that we're using is being representative of all the different crossers at the border, and that we're capturing people who are using the different types of ports of entries and the different lane types. And the same methodology was used for the travel diaries. So for the travel diaries, because it was a more intensive survey and it had a more detailed, more level of detail, the goal for the consultant was to collect 1,500 travel diaries, and we actually received a little over 1,900 travel diaries. And again, a subset of those who submitted a travel diary, we had about 81 respondents who agreed to take the GPS tracker with them. And we just, again, the GPS tracker was just to validate that the diaries, the trip diaries that people were recording, either whether it be through the online survey or the paper, that they weren't under reporting trips, because sometimes people might forget if they traveled to go get gas or stop at CVS to pick up medication. And so we just wanted to use a tracker to ensure that the data that we were getting was valid. So key findings. One of the first key findings that we found through this study was that a lot of these trips start close to the Mexico border. So one of the first questions was, before crossing, what city did you come from in Mexico? And so we had about 88% from Tijuana that went through the San Isidro port of entry, and then we had 91% who came from Tijuana who used Otay Mesa port of entry. And as you can see, this is the overall breakdown in the pie chart. Overall, it was 84% who came from Tijuana who used any of the three ports of entries. Then it was Tecate, Ensenada, Rosarito, and then 1% from another city that was in Mexico. After crossing from Mexico into the U.S., most of the trips in the U.S. that respondents would go to would be close to the U.S. border. They didn't tend to venture too far into their travels, and when we asked what their primary destination was for their trip in the U.S., it was Chula Vista, San Diego, and San Isidro area. North County cities were also mentioned, but they were less than 1%. And those who traveled outside of the San Diego County, that was about 2.9%. The map above that shows, it just shows the distribution of all the stops that all the travelers had made, such as they would go to the mall, or they would go get gas, or they were grabbing lunch, and it just showed where most of those stops were being made. And again, there was about 5,900 trip destinations recorded in this study, and more than 3/4 were clustered in South County. Another key finding is that shopping was the most common reason for crossing the border. When we asked what their primary reason was for visiting the US, shopping was about 52%, followed by work or business, which was 31%, visiting a friend or relative at 9%, medical for 2%, and school for 2%. This was actually similar to the 2011 findings. Shopping was a bit higher in 2010, that was at 55%. Work was a little bit lower at 26%, and visiting friend and relative was a little bit higher at 11%. We think this finding makes sense because the economy was doing really well in 2019 and early 2020 compared to 2010. There was some concern that work trips might be underreported because a person who might be traveling into to the U.S. for work without appropriate paperwork might be reluctant to state their primary trip purpose as work. But interviewers were instructed to note whether a person appeared that they were going to a work destination in U.S., such as if they were wearing a uniform, but they said that their response was to go shopping, but they did, the interviewers did flag, and they would also probe if somebody looked like they were going to work. But the consultants did state that 17% said who said they were going to work did not look like. It said, I'm sorry, I'm messing this up. It says 17% of those who said they were going to work didn't appear like it. But we didn't think that was that big of a discrepancy. And when looking at how primary trip related to other variables, it just showed different patterns that some people would say they were going to work, but then they would do other ancillary trips once they were on this side. When crossing, the average crosser visited multiple destinations, and they spent about 6 hours in the U.S. So when Mexico residents they'd visit about 3.09 destinations overall when they were on this side. And it also varied by primary reason. So for how many hours they would stay here. So those who said they came into the United States for work, they would spend a little bit longer and they would be here for about 8 hours. Those who crossed in for school, they said they would be here about 7 hours. If they were visiting a relative, that was also 7 hours. And if their primary reason was to come here for shopping, it was about 5 hours. We also were interested in what was the mode that they used when they crossed the border. And so most crossed by driving alone or in carpool. As you can see, about over 75% was either driving alone or carpooled, followed by the alternate modes of transportation, which was 12% for biking, 5% for trolley, 3% for walking, and then the 3% at the very end was bus. There's other modes of travel not listed here, but they were less than a percentage. It was like Uber Lyft was 0.43%, premium bus was 0.2%, taxi was 0.2%, motorcycle. So they were very small percentages. Mexico residents' reasons for visiting the U.S. was more for shopping and work, as shown in previous studies. But more than half of the U.S. residents' primary reasons for visiting Mexico was to visit a friend or relative. So overall, U.S. respondents who also reported staying in Mexico, they stayed for an average of 2 days, but the length was longer for those who said they were vacationing. Those who said they were vacationing in Mexico, they spent about 5 days down in Mexico. As I said, the study was to help collect information, preliminary information for State Route 11, the Otay Mesa East Port of Entry. And we just wanted to show the overview of where the different ports of entries was. And so we did, when we asked them if they would use Otay Mesa East crossing without any mention of money, 2/3 said that they would use it. And this was consistent across demographics and trip characteristics. Next slide. So we did this survey because we wanted to test people's willingness to use Otay Mesa crossing at different toll amounts. And so we did a method called Dutch auction. And so we purposely did this so that we would ask the respondent how long they plan to wait prior to crossing the border. How long were they going to be in their lane and expected to wait at the border prior to crossing? And so we wanted to put a real life circumstance, like their current circumstance, while they were waiting at the border, so that they would be able to think about, in the future, would you use it? Because sometimes it's hard to measure what people would really do, like their behaviors in the future. Sometimes they say they would, but they might not really do it when the situation actually arises. And so we wanted them to just remember what they said, which is, how long were you planning on waiting? Like, how long were you expecting to wait at the border today prior to crossing? And so we did this method called a Dutch auction method. And so if people said that they were going to wait at the border for 80 minutes, we would ask them, well, would you pay, you know, if you were only going to wait at the border for 20 minutes, would you then pay? And then depending on their wait time, we would say, would you pay $20, $10, $5, or $3? And then if they were supposed to wait, if they were expected to wait under the 80 minutes, then we did the lower of the threshold, $10, $5, and $3, to be able to just cross the border within 20 minutes. And so we see that the demand is strong related to proposed toll amount. If you see the swing, like there's a 57% swing in the percentage that said that they would use a tolled crossing. When you look at when you move from $20 to $5 for yes, they would pay. Like it's only 21% at $20. But then when you go to the $5 tolled amount, it jumps up to about 79% that they would pay that amount to cross. But then after we hit that $5 crossing, you don't have as much growth when you drop it down to 3%, because then you can see that it only goes up a little bit by like 4, 5, maybe 5% when you ask for $3. When we tested at the highest toll amount for $20, those who were willing to pay the $20 to cross, those were highest amongst U.S. residents, those who were crossing into the United States for medical reasons, and those crossing at San Ysidro or Otay Mesa, and they were waiting in the general lane. COVID-19 impacts. So while this study was going on, we had realized that we needed weekend data collection, because for our activity-based model, for Sandag's activity-based model, we collect information for weekday travel because we're more interested about commute patterns and people going to work and people going to school and dropping off their kids. But the value of time portion for State Route 11, we were interested in weekend data collection because we wanted to see if those travel behaviors, or those who were willing to pay the tolls, would be different on the weekends. But we couldn't start that part of the study because COVID-19 happened and we had to shut everything down. And now the current border conditions only allows essential travel. And so with that, we don't know, we won't get the same robust information we would get if all travel was being allowed right now. So the contract was extended with the consultants. Oh, this says through June 20, I'm sorry, that should say June 30, 2021. In case conditions return back to normal, and then we can try to do weekend data collection again. So next steps. Right now with the data, or with the report where it's currently being finalized, there was a lot of additional analysis that our planners and our modelers had requested from the consultants, so that's being worked on as we speak. There was also a lot of feedback on revisions for things to be changed. The data is being used for a Caltrans grant that Sandag was awarded to update the cross-border model. Sandag has a specific model specifically for cross-border travel, which would be different from different activity-based models that are happening in the region. It's a separate component of it, but we're using it to update it with the latest information. The data is also being used to help inform Sandag's other study that's going on for the traffic and revenue study for State Route 11 and Otay Mesa East. We're presenting the results to both you guys today, Borders Committee and the Transportation Committee. And Sandag, if you don't know, Sandag publishes info bits, and this is where we take like a 1 or 2 pager, or sometimes 4 pager, and we publish that to just summarize the results or key findings from major studies. And so that's probably be in the works. And that's the end of my PowerPoint. Does anyone have any questions?
This is Paul Ganster. Thank you, Grace. That was a terrific presentation, and we look forward to updates as you're able to hopefully collect more data and finish the study off. But I think it really answers or will answer a lot of the questions people have about cross-border movement of people. I think we might have time for a very brief question, but we still have a full agenda, so we move on. So if anyone has a question, could you raise your hand?
Chair, I do see a raised hand for Carmen Romo Diego.
Okay, go ahead.
Hello, everyone, and thank you for the presentation. It was great, Grace. I'm just wondering, with the actual conditions that we have right now, being limited to essential travel, is it an opportunity to actually read or investigate a little bit on the behavior of all the people that actually are citizens and that live in Mexico and that they're going across? Because we still see a lot of movement on the border, and perhaps it can reflect some situation, obviously that it's different because of the COVID-19, but still it will give us data like how many citizens they're actually living in Tijuana. So I don't know if there's any considerations of trying to gather data. I know you mentioned that the contract kind of stopped because of this COVID-19, and it was just a question if there were any measures just to read what is going on with this actual situation on the border.
Right, so we didn't collect information on citizenship just because we know that that can be a little bit sensitive, but we did ask where people's primary residence was, whether it was Mexico or the US. As far as travel conditions right now, we stopped just due to safety, and so we're hoping to resume if things start to look like it's going back to normal. I see 2 questions in the chat too. Did you want me to address those?
You know, I think we need to cut it off there because we still have the other presentations to deal with. But
okay.
Grace, thank you very much again for the presentation, and we look forward to updates. So thanks a lot.
Sounds good. Thank you.
Let's move on to our next presentation, which will be the Metropolitan Planning Institute of Tijuana, or IMPLAN, and we'll be hearing about the City of Tijuana's Municipal Urban Development Plan 2020 to 2040. These instruments, which are available for many Mexican cities, are extremely useful in terms of the information and analysis they present. So this is a terrific resource. Rodolfo will be joined in the presentation by Arquitecta Belén Cristina Q. Amador and Ingeniera Andrea Alonso. So Rodolfo, please take it away. And it will be in Spanish, I understand, so you will use your interpretation if you need to. There's the little globe on your toolbar at the bottom.
Buenas tardes. Aclaramos que este programa es una actualización del programa 2010-2025, que también es el programa de desarrollo urbano del Centro de Población. Entonces, ha habido 3 programas anteriores que se han realizado y el último fue el del 2010, ¿no? Adelante a quien esté manejando la presentación. Ok, esta es la introducción y realmente es una introducción hecha para una presentación a todos los grupos, pero básicamente lo que establecemos es que este programa busca resolver los temas críticos de la ciudad y identifica la problemática, construye una visión, objetivos y metas, políticas y estrategias, y después hace propuestas de proyectos estratégicos para resolver estos problemas, ¿no? Adelante. Este es el proceso que hemos pasado para llegar hasta la publicación. El instrumento de planeación no es válido hasta que no está publicado, y está también publicado en diarios de mayor circulación, así como inscrito en el registro público de la propiedad, ¿no? Entonces, básicamente, este es el proceso que se sigue, ¿no? Para realizar un plan que se lleva aproximadamente un año. Adelante. Y esta es la estructura del documento, ¿no? Tiene el apartado de antecedentes, donde está la presentación, la justificación, fundamentación jurídica y metodología, y la delimitación del área de estudio. En este caso, el área de estudio o el área del Ayuntamiento de Tijuana fue afectada por un convenio que se hizo con Tecate. Entonces, vamos a decir, perdió el municipio de Tijuana varias hectáreas, y por lo tanto afectó a los subsectores, que es como está organizada la ciudad para su análisis y su planeación, ¿no? Después tenemos el diagnóstico pronóstico, un capítulo del estratégico, el programático, el instrumental y la bibliografía y anexos, donde también vienen los planos y mapas. Adelante. Bueno, estos son los objetivos generales, ¿no? Que básicamente están enfocados al tema de las actividades urbanas, del medio ambiente, el tema de riesgos, el patrimonio cultural, la imagen urbana, que estos dos temas casi no se habían desarrollado en los programas anteriores, ¿no? Y lógicamente el impulso al desarrollo económico. Adelante. Bueno, estos son los antecedentes de planeación, ¿no? Tenemos desde la Constitución Política de México, la Constitución del Estado y los reglamentos municipales, ¿no? Adelante. Y estos son los antecedentes de planeación superior, ¿no? Que hay que incluir en todos los programas nuevos. La nueva agenda urbana, el programa de las Naciones Unidas para el Desarrollo y la Agenda 2030 y los Objetivos de Desarrollo Sostenible. A nivel federal, pues tenemos el Plan Nacional de Desarrollo, regional el Programa de Ordenamiento de la Zona Metropolitana de Tijuana, estatal el Plan Estatal de Desarrollo, y municipal el Plan Municipal de Desarrollo, el de Desarrollo Urbano, el de Ordenamiento Ecológico, el de Resiliencia Urbana para el municipio y el Atlas de Riesgos. Adelante. Bueno, uno de las características que tiene este programa es que tuvo una gran participación ciudadana, porque durante el proceso, desde el diagnóstico, se hicieron diferentes talleres, ¿no? Que se compartieron con el programa de movilidad, el PIMUS. Entonces, durante todo el proceso se realizaron varios ejercicios presenciales, y después una de las cuestiones por lo que este programa no se ha mandado a publicar es porque faltaba la última consulta, que es cuando el documento está terminado y le llamamos borrador a ese documento, porque falta que los ciudadanos vean cómo se aplicaron las propuestas que ellos hicieron, así como las propuestas derivadas de los estudios técnicos, ¿no? Entonces, esto es lo que está ocurriendo ahora. El programa está en consulta en internet, en una plataforma para consulta pública en la página del INPLAN. Adelante. Y bueno, aquí nada más se explica bajo la ley de planeación, que le otorga atribuciones al INPLAN para que en este caso realice consultas públicas y haga la creación del Consejo consultivo ciudadano para que puedan ser presentados todos los planes y programas, ¿no? Y que diseñe bajo qué mecanismos en cuanto a foros, talleres, consultas o actividades se va a realizar la participación ciudadana, ¿no? Entonces es una atribución del INPLAN. Hubo una consulta ciudadana muy amplia el 17 de junio del 2019 en la Universidad Autónoma de Baja California, que fue uno de los principales participantes en este programa, ¿no? Y después, el 1 de septiembre, perdón, el 2 de septiembre se hizo una consulta con el Consejo Ciudadano para el Desarrollo Urbano, que es el consejo que creó el INPLAN, y donde se presentó este programa para que quedara a disposición de todos los ciudadanos y los sectores durante 30 días. Esos 30 días, bueno, pues se acaban de vencer la semana pasada. Sin embargo, estamos todavía recibiendo propuestas porque para que el programa llegue a su publicación necesita pasar por la aprobación del Cabildo y después de la Comisión Coordinadora del Desarrollo Urbano, ¿no? Entonces, todos esos días que tenemos antes de que ocurra eso, los estamos aprovechando para seguir recibiendo propuestas. El jueves tenemos una propuesta con los colegios de ingenieros y arquitectos y con la Canadevi, la Cámara de la Vivienda, donde ellos, pues, como tienen algunas observaciones y dudas, quieren que de manera presencial se les haga una explicación de muchos de los temas que ellos consideran que deben de explicarse más a fondo, ¿no? Entonces, a pesar de que los 30 días se vencieron, pues la ley habla de 30 días mínimo, pero pues no habla de un máximo, entonces vamos a, tal vez a final de cuentas terminemos con 60 días de consulta, ¿no? Adelante. Y bueno, en la página del INPLAN, en el portal, aparece una pestaña que dice consulta pública y si ustedes entran van a encontrar el documento y ahí es donde pueden consultar el documento. Adelante. También vienen otras pestañas donde viene la consulta de la Carta Urbana por transectos y usos propuestos, porque ahora se ha organizado la ciudad en base a transectos, que son agrupaciones de usos del suelo que se usan para varias zonas y donde se logra una zonificación un poco más amplia y libre. Y después también se cuenta con una carta urbana donde vienen ya los usos más especificados, ¿no? También pueden consultar la cartografía y por último hay una pestaña donde pueden ingresar comentarios y propuestas para el programa, ¿no? Adelante. Bueno, aquí empezamos con el diagnóstico, adelante. Y lo primero que empezamos a ver es el municipio de Tijuana o el centro de población en la región, ¿no? Y sabemos pues que estamos en la frontera con el condado de San Diego, entonces uno de los temas más importantes lo hacemos en los temas binacionales y transfronterizos, ¿no? Y este mapa pues lo pongo porque es un mapa que en el 2008 hizo SANDAG con la colaboración de INPLAN, que es de usos del suelo de los dos lados de la frontera, ¿no? Y sabemos que por más de 20 años SANDAG y el INPLAN han tenido colaboraciones, ¿no? Nosotros hemos recibido mucha ayuda de SANDAG, capacitación de técnicos de aquí en ARGIS y en otros programas que son de planeación. Y también por el otro lado, nosotros los apoyamos en todo lo que podemos, brindándoles información de los estudios que realizamos de este lado, ¿no? Adelante. Bueno, esta es la zona metropolitana, comprende la totalidad de los municipios de Tijuana, Rosarito y Tecate, ¿no? Playas de Rosarito se llama. Y ahí vemos las manchas urbanas en amarillo. Tijuana representa el 90% de la mancha urbana y de la población. Entonces, pues Tijuana está considerada la ciudad central de la zona metropolitana y la zona metropolitana es conocida como zona metropolitana de Tijuana, ¿no? Pero el espíritu de esta de esta área de la zona metropolitana es de trabajar unidos y realizar proyectos conjuntos, ¿no? Como puede ser un rastro de escala metropolitana, una central de abastos, un relleno sanitario que la ciudad de Rosarito requiere uno y Tijuana también. Entonces tal vez una de las dos ciudades pone el terreno y la otra pone el proyecto y la obra y las vialidades necesarias. Entonces el espíritu del tema metropolitano es trabajar como una ciudad de ciudades, ¿no? Que haya una colaboración intensa y bueno, lógicamente que también en otra escala y con más limitaciones, pero que lo hemos estado haciendo, es trabajar de igual manera con la ciudad de San Diego en problemas comunes, ¿no? Adelante. Y bueno, aquí viene el diagnóstico del medio físico transformado. Tenemos algunos ejemplos. Aquí voy a pedirle a la arquitecta Belén Cubo, que es directora de Planeación Territorial del IMPLAN, que nos explique las siguientes láminas.
Gracias, arquitecto. Muy buenas tardes a todos. Les voy a hablar un poquito acerca de algunos temas que tienen que ver con el medio físico transformado y que también pueden consultar en lo que es el documento que está en nuestro portal de Internet. Entonces, bueno, aquí lo que observamos es que también derivado de la publicación de los estatutos territoriales, los nuevos estatutos territoriales en 2020, se reestructuraron, como comentó el arquitecto Argote, nuestros límites municipales y al interior de nuestros límites tenemos otras superficies que son motivo de nuestro análisis. Para este caso, pues se reestructura lo que es la superficie del centro de población, que es esa superficie a la que hace referencia este programa, y esta se reduce de 92,000 hectáreas que teníamos en 2010 a 90,000 hectáreas en 2020. Entonces, a raíz de esta reducción también se reduce lo que es nuestra área urbana y todas nuestras unidades de análisis que hacen referencia a sectores y subsectores. Entonces, como se puede observar con una comparativa hecha desde el 2002 hasta el 2020, podemos ver que el mayor incremento con respecto al crecimiento urbano se advierte entre el periodo de 2002 a 2010, con aproximadamente 13,000 hectáreas. Y en 2020, lo que es de 2010 a 2020, el incremento de superficie alcanzó únicamente 2,208 hectáreas aproximadamente. Y esto está muy relacionado con la superficie que está fuera de lo que era el área urbana identificada en 2010, no es como expansión del suelo urbanizado hacia el exterior. Sin embargo, lo que sí hemos advertido u observado con las diferentes análisis o caracterizaciones que hemos estado realizando es que al interior del área urbana se ha tenido un mayor auge el desarrollo que es en vivienda de modalidad vertical, se ha intensificado un poco más también lo que es el uso de suelo y la densificación, y se han realizado también grandes desarrollos comerciales o tiendas ancla, y se identifican también lo que son el desarrollo de equipamientos urbanos, sobre todo en materia de administración pública, ¿no? Entonces también hemos identificado
This is Sandag Production. We still have audio. Okay, I'm not sure what's happening with her connection, but you're still in the meeting and we still have audio. I'm the host.
¿Me escuchan a mí?
¿Me pueden escuchar ahora sí? Bueno.
Yes, we can hear you now.
Muchas gracias. Sí, se desconectó mi internet, una disculpa. Entonces, sí, podemos continuar con la siguiente lámina.
Give us one moment.
Gracias. Muchas gracias. Nada más quisiera, ok, perfecto. Nada más quisiera confirmar si se alcanzó a escuchar toda la explicación de esta lámina.
Sí.
Ok, perfecto. Gracias. Siguiente, por favor. Muy bien, en esta lámina lo que estamos mostrando está relacionado con los usos y destino de suelo actuales. Este proceso de reconocimiento de los usos actuales es permanente, por lo que se están realizando también cortes periódicos para la estimación de superficies y los porcentajes de aquellos usos y destinos que estamos reconociendo o estamos identificando en nuestro territorio. Entonces, de conformidad con el análisis que tenemos para este programa, para esta actualización, y con la caracterización de usos que tenemos, pues se advierte que el uso habitacional es el que tiene mayor proporción tanto a nivel centro de población como a nivel área urbana. De ahí ya van disminuyendo los porcentajes de los usos de suelo identificados que están relacionados, le sigue del habitacional, le seguiría lo que es el derecho de vía y todo lo que corresponde a vialidades o instalaciones también de infraestructura. Luego vendría lo que es el suelo desocupado o el suelo baldío que todavía está disponible al interior del centro de población. Luego vendría lo que es el uso industrial y en un menor porcentaje y proporción los usos que hacen referencia al equipamiento urbano, al uso especial, a conservación, actividad primaria, al uso mixto y al área verde. Siguiente, por favor. Algo que incorporamos en esta nueva actualización hace referencia a lo que es el índice de mezcla de usos de suelo. Y esto a lo que nos ayuda es que mide el grado de concentración de los usos de suelo en un área determinada, donde los valores más cercanos a cero nos están indicando una alta concentración de un uso de suelo, es decir, la mixtura de usos es mucho menor. Y cuando el valor es más cercano a 1, la distribución de los usos de suelo es más equitativa y esto quiere decir que también hay una mayor mezcla o una mayor mixtura de usos. Para el caso particular de esta actualización, tomamos en consideración lo que son las superficies de los usos habitacionales, de comercio y servicio, de equipamiento urbano, industrial, especial, uso mixto, uso de conservación, actividad primaria y área verde. A nivel general, lo que identificamos es que la distribución de los usos de suelo pues no se ha dado de una manera equilibrada, tanto a nivel centro de población como a nivel sector, ya que todos los factores que nos están arrojando ahorita pues se encuentran muy por debajo del 1. Sin embargo, lo que sí se ha ido identificando o que podemos ir reconociendo un poco más es que hay ciertos sectores donde ya se está dando un poco más esta mezcla de usos, ¿no? Entonces identificamos alrededor de 5 sectores donde esto está sucediendo. Y si bien el índice sigue siendo bajo, pues ya vamos identificando más zonas que presentan o que van, digamos, van en aumento con esta mezcla de uso. Los valores que nos arrojaron como ceros corresponden también a aquellos sectores con poca o nula ocupación urbana. Siguiente, por favor. Para el diagnóstico del medio físico natural y hablar un poco más también de lo que es medio físico transformado y la síntesis de la problemática, le pediría a mi compañera a Andrea Alonso, que es la jefa del Departamento de Planeación Urbana, que nos apoye con las siguientes láminas.
Muchas gracias, Belén. Buenas tardes a todos. Respecto al diagnóstico del medio físico natural, se obtuvieron los últimos datos de los últimos 10 años respecto a los principales indicadores en lo que es la problemática ambiental. Se caracterizó al centro de población en lo que es el medio físico natural. Se diagnosticó y se identificaron las principales reservas naturales y se señaló la importancia de lo que es la declaración de las áreas naturales, como ha sido en los últimos 10 años, que son la Cañada, los Sauces Sur y el Cerro Colorado. Y de igual manera se utilizó como principal insumo el Atlas de Riesgo Municipal del 2014 para lo que es el diagnóstico de la vulnerabilidad y riesgos en Tijuana. Siguiente, por favor. Un principal insumo que se tuvo en este programa fue la generación del modelo de aptitud física, del modelo de vulnerabilidad y el modelo de riesgo físico, los cuales se generaron con los insumos del diagnóstico de medio físico natural y en los cuales de manera integral y ponderada generan lo que es el modelo de aptitud territorial, que nos servirá más adelante para lo que se genera lo que es la zonificación primaria y uso de suelo. Siguiente, por favor. Respecto a la síntesis de la problemática en lo que es en el medio físico transformado podemos seguir viendo déficit en lo que es el equipamiento urbano en todos los subsistemas, cuestión que impacta directamente en el sector social, dando espacio a la generación de violencia e impactando en la convivencia y formación de valores en la población. Respecto al espacio público, su dosificación se ha desarrollado de manera dispersa, sin considerar su funcionalidad y conectividad con el entorno urbano próximo. Y en lo que se refiere a la movilidad, aún se detecta la falta de conectividad eficiente entre las zonas residenciales con las zonas de trabajo y comercio, a través de una estrategia integral que cubra las necesidades de la población y reduzca los tiempos del traslado, los costos, así como el parque vehicular. Siguiente, por favor. En lo que respecta a la infraestructura y servicios urbanos, no, la anterior. Creo que nos adelantamos, no había visto nada. Una antes. La del mapa de naranja con rojo. Ajá, la otra. Ya, gracias. Me lleva la secuencia. En lo que respecta a la problemática de infraestructura y servicios urbanos, se observa en Tijuana la total dependencia respecto a otras zonas para el suministro de servicios e infraestructura. De igual manera, respecto a la problemática que se identificó en el diagnóstico en las diferentes infraestructuras y servicios urbanos, se identificaron los sectores que presentan problemas en la operación de los sistemas de infraestructura y los que concentran mayor superficie en cuanto a zonas que no cuentan con la prestación de superficie de servicios, para la comunidad, lo que generó el mapa que pueden ver a su derecha. Ahora sí, siguiente, por favor. Entrando al tema de pronóstico y análisis de tendencias estadísticos, siguiente, por favor. Iniciamos con lo que es la perspectiva de crecimiento de población del 2018 al 2040. Con el fin de definir el comportamiento de crecimiento poblacional en el centro de población, se retomó información de INEGI, CONAPO y estimaciones propias de INPLAN, analizando 3 escenarios, el tendencial, el probable y el deseable. El escenario tendencial muestra un ritmo de crecimiento poblacional en el que durante las últimas décadas registra tasas con tendencia decreciente. Para el 2020 se registra una tasa de 1.21%, mientras que para el 2040 se espera que disminuya a 0.98%. El escenario que utilizaremos para el análisis tendencial, que es el deseable, dio como resultado una población al 2040 de 2.320.921 habitantes en lo que es el centro de población. Siguiente, por favor. De igual manera, utilizando estos datos y datos de estudios e indicadores, se calculó el pronóstico en respecto a protección ambiental en temas como cambio climático, disponibilidad, educación y consumo de agua potable, generación y captación de residuos sólidos urbanos, emisiones de contaminantes, cambios en la cobertura vegetal esperada por la presión que tenga el crecimiento de la mancha urbana. Siguiente, por favor. De igual manera, siguiente, por favor. Acá. De igual manera, con los datos de población se calculó lo que es la demanda de infraestructura respecto a todos los principales servicios para la población, como es el agua potable, el tratamiento de aguas residuales y aportación de aguas residuales, el consumo eléctrico estimado, la demanda de gas LP y gas natural, la demanda del sistema pluvial, identificándose las necesidades futuras respecto a estos servicios con el fin de contribuir a un crecimiento ordenado y atender de manera oportuna la reposición y modernización de los sistemas. Siguiente, por favor. Le regreso la palabra a mi compañera Belén Cou.
Muchas gracias. Bueno, ya como para cerrar lo que es esta parte del diagnóstico, vamos aquí en esta lámina lo que estamos señalando es el requerimiento de suelo por cada uno de los conceptos que se analizaron y se pronosticaron en esta etapa, ¿no? Entonces, de conformidad con la población que está proyectada al 2040, que son 2.320.921 habitantes aproximadamente, y tomando en consideración los resultados que se obtienen con respecto al requerimiento en materia de vivienda, de equipamiento o infraestructura, infraestructura, se estima un requerimiento de suelo urbano aproximado de 16.564 hectáreas. Dado que al interior del área urbana se identifica una superficie aproximada de 6.350 hectáreas que corresponde a baldíos y a la vez considerando también la existencia de viviendas deshabitadas, las cuales representan una superficie aproximada de 1.929 hectáreas, se tiene que en conjunto hay un total de 8.280 hectáreas que pudieran solventar el requerimiento que estamos señalando, quedando un remanente, digamos, o una demanda de suelo urbano de 8.284 hectáreas. En esta imagen lo que podemos ver es que estamos separando por cada uno de estos rubros o por cada uno de estos aspectos el suelo que se requiere para cada uno de ellos. Siguiente. Para empezar a hablar un poco de lo que es el apartado estratégico, le regresaría la palabra o le pediría al arquitecto Rodolfo Argote que nos apoyara con estas láminas. Gracias.
Sí, esta es la visión que se ha construido desde hace 10 años para la ciudad de Tijuana, y la visión nos permite complementar la parte de los estudios técnicos con la parte de participación social, donde los ciudadanos dicen qué ciudad quieren para el futuro, ¿no? Entonces, esta es la visión que se ha construido, y esta visión nos permite también formular estrategias y políticas, ¿no? Adelante. Y bueno, los ejes que se utilizaron para realizar estos objetivos están en lo que es la planeación, integración metropolitana, integración urbana, gestión del suelo, infraestructura, movilidad. Adelante. Imagen urbana, medio ambiente, resiliencia, riesgos y vulnerabilidad, participación de la comunidad y administración urbana. Adelante. Bueno, este es un mapa que se hizo con las políticas de desarrollo, donde tenemos aproximadamente 10 políticas distintas, donde viene conservación, donde viene crecimiento, crecimiento con control, densificación, densificación con control, etcétera, ¿no? Pero estas son las políticas que se desarrollarían derivado tanto de los estudios como de la parte de participación ciudadana y la visión. Adelante. Y aquí hay algunas de las estrategias propuestas en el tema de densificación y mezcla de usos. Pues estamos planteando que la ciudad empiece a tender hacia una ciudad policéntrica, ¿no? También viene la parte de planeación por transectos, que es una forma de analizar y de proyectar la ciudad y de planearla a través de esta zonificación que es más amplia que la zonificación puntual. En cuanto a regeneración urbana, es el tema de la capacidad de carga urbana, identificar en qué partes de la ciudad podemos densificar y también en qué partes debemos de hacerlo con control o no hacerlo. En el tema de gestión de riesgo, desastres y adaptación, la atención a las zonas de riesgo, que hemos tenido varios eventos de deslizamiento, y en la estrategia para la movilidad urbana, el tema del sistema integrado de transporte que inició con una ruta y se tiene que continuar. Adelante. Estas son el principio de la zonificación por transectos, ¿no? Que es tener desde el transecto 0 al transecto 6 una serie de características homogéneas de cada zona donde está el transecto, donde todo es rural, donde no es urbanizable por cuestiones de riesgo o por cuestión de presencia de zonas naturales protegidas, el transecto suburbano, el barrial, el distrital, el central y el especial, ¿no? Y todo esto va creciendo, vamos a decir, de lo no urbanizado a lo superurbanizado o muy densificado, ¿no? Esa es la idea básica de los transectos, ¿no? Adelante. Y este es el mapa de la zonificación por transectos, ¿no? Donde vemos los 7 transectos que están distribuidos por el territorio. Vemos una parte donde es el transecto central, donde está la zona centro, parte de la zona río en una forma lineal, y es donde se están dando y se van a seguir promoviendo la existencia de equipamientos y de infraestructura a un mayor nivel, ¿no? Obviamente también se busca darle esa orientación a los demás transectos o a las demás zonas para que se vaya formando esa ciudad policéntrica que queremos, que sería una ciudad policéntrica lineal. Adelante. Y aquí está nada más la explicación de los transectos, ¿no? Del transecto 0, luego apareció ahí, después del transecto 6, que son 7, un transecto 7, que es para equipamiento urbano, donde está el aeropuerto, la universidad y otros grandes espacios, pero que ya están destinados a un equipamiento específico. Adelante. Bueno, estas son las matrices de compatibilidad, ¿no? Que están muy complejas, adelante, pero buscan ya especificar qué usos están relacionados con otros, ¿no? Y esta sería la carta urbana ya más específica, donde están formados los transectos, pero dentro de cada transecto encontramos que hay distintos usos que son ya planeados por el mismo transecto o que están contenidos en el transecto, pero también otros transectos menores que están dentro del mismo transecto, ¿no? Igual, esta es una carta urbana que en el futuro ya no se va a necesitar, ¿no? Porque lo importante va a ser que el uso que estamos tratando de implementar en alguna de las zonas esté contenida en el transecto, ¿no? Y si no lo está, entonces que se haga un estudio de impacto urbano, impacto vial, etcétera, para lograr analizar si es viable. Adelante, ya vamos a terminar prácticamente. Y los proyectos estratégicos, ya nada más les menciono 2 o 3. Adelante. Adelante. Vienen los ejes y el tema binacional. Adelante. En la integración metropolitana, pues está el Instituto Metropolitano de Planeación, que bueno, busca que las 3 ciudades participen en uno de los proyectos, el Banco de Proyectos Metropolitanos. En lo binacional está el Plan Maestro, el Plan Maestro Fronterizo, donde estamos colaborando, el Puerto Fronterizo TAI 2, que obviamente acaban de anunciar que ya viene con fuerza ahora sí en el 2021. Y otros proyectos, ¿no? Un foro permanente de planeación y colaboración, que sería los implanes con SANDAG, ¿no? En el tema de medio ambiente, pues los temas de control del aire, estaciones de monitoreo, etcétera, ¿no? En resiliencia urbana, pues los temas de los deslizamientos y realizar acciones de mitigación de riesgos en las zonas vulnerables, ¿no? Que ya sabemos que han ocurrido eventos. Adelante. En cuanto al CELO, pues está el estudio de capacidad de carga urbana del centro de población para determinar esta posibilidad de densificación y crecimiento en ciertas zonas, ¿no? Y en la infraestructura urbana, el sistema vial metropolitano, proyectos de bulevares, el sistema vial está incompleto, ¿no? Adelante. Y del medio físico transformado, pues muchísimos proyectos de movilidad urbana, de vivienda, de turismo, de imagen urbana, de equipamiento, que como ven en equipamiento son muchísimos proyectos, ¿no? Que son necesarios y que consideramos que deben estar para el 2040. Con esto terminamos la presentación, esperemos no habernos tardado demasiado. El documento está en línea, pueden poner comentarios, observaciones y todo lo que ustedes gusten. Muchas gracias a nombre del IMPLAN.
Thank you very much, Rodolfo, and thanks to you and our colleagues from IMPLAN. Terrific presentation and a great effort and a great document. We'll have to save any questions there might be for afterwards if there's time, but I do want to announce that we're able to extend the meeting for another 10 minutes or so because we have a very important presentation by Justine Kozo from the Office of Border Health in the county, who's going to talk about coordinating cross-border health during COVID-19. So we'll move right to Justine, please. Thank you.
Good afternoon, everyone. Thank you so much for inviting me to present to you all today. I know we have a bit of a time crunch. I usually do these types of presentations anywhere from 30 minutes to an hour, but today I'm giving you the abbreviated version. It's going to be about 5 minutes. And I just want to say, if you ever want to talk about my work outside this call, I'm happy to do that with you. I was asked to talk a bit about binational health collaboration prior to COVID-19, as well as give you an update on how we've been working binationally with our counterparts in Baja California during the pandemic. So again, thank you so much to Hector and Zach for inviting me here today. Next slide. I won't spend too much time on this. I think everyone on this call very well knows the beauty and challenges of living in one of the most traversed regions in the entire world. For me, to be a border region is definitely a sense of pride. And I always like to share with people that the 1983 La Paz Agreement highlights that our border area is 60 miles north and south of the actual physical border, which means we are all in the border region, most likely right now, and all the way up to, Carlsbad and Oceanside and the San Diego side. And I just want to give a shout out to SANDAG. I always use their data to really illustrate the fluidity of our region. And we know from their 2019 border crossing report that there were on an average day, there's over 200,000 northbound crossings in our Baja California border region. And I also want to thank Grace for her excellent report earlier. I love looking at data and understanding the reasons why people cross the border. We know that people cross the border, according to her data, for recreation, employment, to see family, healthcare, a variety of reasons. But we know this creates a very interconnected, interdependent region. And from a public health perspective, we know that diseases do not recognize borders. And it's very important that the leadership in both California and Baja California collaborate to address common shared public health challenges. So I'm just very fortunate that at the County of San Diego, our leadership, our Board of Supervisors, our Director of Health and Human Services all recognize the importance of having strong cross-border relationships to support the needs of our shared community. So next slide, please. So this is our Office of Border Health. I am located within Health and Human Services Agency. I'm the chief for the Office of Border Health. I have one full-time staff that works with me, Isabeth Rodriguez, and then we employ a lot of graduate student workers. Our office was inaugurated in 1993, and really the crux of our office is to focus on cross-border communication, collaboration, and coordination. And as a local county health department, we really primarily collaborate with our counterparts in Tijuana, who are ICE Salud, the Jurisdicción Número 2, representing Tijuana, Tecate, and Rosarito. But of course, we have a lot of vertical and sideways collaboration with other agencies that work across the border, both government and non-government. Our key activities really focus on, again, relationship building. We do a lot of support of cross-border infectious disease surveillance. We work on several cross-border initiatives, and health diplomacy is central to all the work that we do. Next slide, please. So just a few examples. I am only scratching the surface, but I work for our public health officer, Dr. Wilma Wooten. I'm sure you've seen her a lot in the news lately. And it is very important to her to have a strong relationship with her counterpart in Tijuana, the health director of ICE Salud. Right now, that person is Dr. Remedios Lozada. Because of the COVID-19 pandemic, they still have not met in person. She kind of came into leadership right when all this stuff was happening at the earlier part of the year. So these are some dated photographs, because the bottom one also reflects a meeting with the consulate, the Mexican consulate here in San Diego. I can't say enough how important that relationship is, and I will talk more in detail about how we've been working together for COVID-19, but our leadership really supports having a strong relationship with the Mexican consulate here in San Diego. We're forever grateful to them for their partnership. So another thing that, this is just one example, but we work a lot on cross-border emergency communication, also looking at processes to improve cross-border emergency medical services, such as the transfer of patients across the border. And we also convene 2 large leadership meetings. One is called the San Diego Border Health Collaborative, and the other one is the Border Health Consortium of the Californias. You were all invited to these meetings. Next slide. I will say, though, they are on pause because of COVID-19, but there's still a lot of activity happening within the work groups. This is the Border Health Consortium of the Californias. It brings leadership together from both California and Baja California, again, government, universities, nonprofits, healthcare sectors. And really the purpose is we meet twice a year. We discuss a lot of key issues, share information. It's focused on building relationships and connections. And within this group, we have 5 cross-border work groups that address HIV, tuberculosis, obesity, mental health, and cancer. And those groups have been very active for many years, and some have still been very active during COVID-19, such as the mental health work group, which I facilitate. And we're putting on a conference, a virtual conference next month. You'll hear more about that. Next slide. We also have the San Diego Border Health Collaborative, which meets every other month outside of COVID, and it focuses on the north part of the border, so kind of the San Diego region. We bring a lot of researchers to these meetings. Dr. Ganster has presented his excellent work with climate change and addressing vulnerability in our border communities. So we bring a lot of experts, subject matter experts, come to these meetings, present their research, present their projects. But again, it's kind of focused more on the San Diego region. Next slide. I mentioned that we support cross-border epidemiology or epidemiological surveillance initiatives. This has been a long-standing collaboration for many years. Our county epidemiology branch works very closely with our California Department of Public Health Office of Binational Border Health on cross-border binational case notification surveillance. We meet with them quarterly, or I should say, we convene our epidemiologists in California and Baja California quarterly, alternating between San Diego, Imperial County, Mexicali, and Tijuana. So lots of communication there on a daily basis right now during COVID-19. There's also a lot of work being done in cross-border HIV. In the last year, we've been developing a binational epidemiological profile to understand the HIV challenges and looking at San Diego and Tijuana as one region. We also do work on vector-borne and zoonotic disease collaboration. We have annual conferences where we have presenters from Baja California come and present on their work in this area. And then something that's a really phenomenal project that's been going on for decades is the Cure Tuberculosis program. And that was developed in San Diego County. And it's basically a program that helps connect individuals that have tuberculosis and are crossing the US-Mexico border and need to have enough medication to stay adherent to their treatment and to make sure that they're connected to care in their destination. This project has been so successful that the Centers for Disease Control adopted it in the last couple of years and has made it global and helps coordinate care continuity for people traveling all over the globe. Next slide. This is a project where we work to improve communication with non-English speaking communities during disasters. I won't go into any detail about it though now. Next slide. And this is one of my colleagues, and she's a champion for binational work as well, Barbara Jimenez. She's the Director of Operations for Health and Human Services Agency. She does a lot of great work outside of COVID-19, but we will talk about that at another time. Let's move to the next slide. Okay, these are some of our key partners. This is just a few. I'm scratching the surface here, but I just really, again, want to call out the Mexican consulate, also the US consulate in Tijuana, the city of San Diego, lots, we have partners at the federal level, the state level, and the local level, and we couldn't do our work without these great partnerships. Next slide. I will be concluding here, and I just want to take a few minutes to talk a little bit about the COVID-19 response. The county has organized itself into 10 critical sectors, and they devoted one of these sectors to binational communication and collaboration. I am co-leading this sector along with Barbara Jimenez. We have been conducting bi-weekly calls with key partners. There's many of those partners on this call. It's primarily government folks, but there are some others representing universities and nonprofit organizations. We are having our 15th call this Thursday. Every 2 weeks, we come together. We have simultaneous interpretation, just like today's call. We have epidemiological updates from both San Diego and Tijuana, as well as updates on key pertinent issues from our partners. We're also busy responding to lots of inquiries and requests. This has been an ongoing thing for many months. Everything from transporting a large PPE donation to Tijuana. Right now, the State of California Office of Emergency Services has donated 87 pallets of material to the County of San Diego, and the Mexican consulate is helping us get the authorization to transport this to our colleagues and counterparts in Tijuana. It has been a huge collaborative effort. Huge thanks to everyone. I've worked very closely with Denise Garcia on a number of challenges, issues. We've been on presentations together, troubleshooting, connecting people. Also, the Mexican consulate, a wonderful collaboration that is very recent is the establishment of a free testing site at the Mexican consulate on Mondays. Consul Gutierrez mentioned this at the beginning of the call, and we are just so appreciative of this partnership and appreciative of all of their support. We've been working with the consulate on data sharing, a variety of other things that have come up throughout the pandemic. We also put together a bi-weekly newsletter that highlights some of the resources and things that are happening in COVID-19 and how it affects our binational community. And let's see, I don't know what else to say. I also want to thank SANDAG. SANDAG has produced some phenomenal reports looking at the causes and reasons behind the disproportionality of how the Latinx community has been affected by the COVID-19 pandemic, and the SANDAG publications that have come out with that have really empowered me to vocalize our concern and help articulate these challenges. So I really could go on and on, but I know that we are past time. I want to thank everyone again for inviting me here today, and thank everyone for their partnership and collaboration. And I'm always happy to talk offline if you have any questions. Thank you.
Well, thank you, Justine. That was great. And my apologies for cutting back on your time. I really think today we actually could have used a full hour for each presentation. They're also full of excellent information and analysis, but I think we've got a good sense of what's going on in 3 key areas. So thank you all for attending. Now, our next, we won't have time for Q&A, unfortunately, but we'll just have to live with that. Our next COBRA meeting was scheduled for December 1st, but that will be scratched, and instead we're going to link on October 29th at SANDAG's working group workshop for the 2021 regional plan, and we're planning a second binational workshop in partnership with Implan. We had one last December that was very successful, and now we're tentatively scheduled for November 9th, but we'll hear from staff soon about when that is firmed up. Again, thank you very, very much to the presenters for all your work and really incredible presentations, and I look forward to meeting with you all at the end of the month and on November 9th. So thanks to the managers and organizers of the event and the translators as well. It really went much more seamlessly than I had expected. I'm a bit of a technophobe, but I guess all things are possible in the new reality of COVID. So have a good afternoon, and thanks again to everyone. Carlos, did you have some final comments? My co-chair, if he's still on. Probably not. We ran over and he tends to be pretty booked up. So with that, we'll just leave it and stay well.